Hi, this is Dr. Toby Moma inviting you to watch our show this week, Health and Wellness with Dr. Toby, with Dr. Enaka Yembe. Dr. Enaka Yembe is a multi-gifted, well-traveled doctor. She trained in Lagos, Nigeria for her undergrad in biochemistry, and then she went to the University of Milan in Italy for her medical school. After spending her time in a Catholic high school in Cameroon, she now moved to the United States, and she's been in Monroe, Louisiana, West Monroe since for the last 17 years. She's a part of this community, and she's coming to share her heart with us on how to stay healthy, how to overcome barriers. She's a successful female medical entrepreneur. She's a mother, she's also a daughter, she's a sister, and she's a committed member of a Baptist church in the community. You will want to hear what she has to say. I'm looking forward to seeing you on our show. Don't forget, write to us, keep in touch. Jesus is Lord. Hi, this is Dr. Toby Moma. I'm a family physician at the University of Mississippi. It's a pleasure to have you on our show today. What an honor. Don't touch that dial. We have a great guest. Her name is Dr. Enaka Yembe. Dr. Enaka, you're welcome.
Thank you,
On
Dr.
the
Moma.
show.
Thank you for having me.
And she's one of my favorite persons, always ebullient, always lively and excited. And it's a pleasure to have her on the show with us today. And last week she was sharing about her conversion experience, how in the midst of her worst time, her throes, her rock bottom moment, God came in and turned her story around. And she was about to share what happened in that rock bottom moment, and I told her we'll continue on this show. So you're in for a treat. So just stay tuned. Dr. Naka is going to tell us about her experience on that day in 2006. Let's hear what happened.
Yes, well, I mean, like we were saying, I had reached the point where I felt I was fulfilling my dream. I had finally become a licensed physician. I was taking care of people. I love taking care of people, doing really what I think I was born to do. And then I was taking care of my children as well. I had a medical condition, though, that I had been warned as I was going along. I had been told to take care of this. But because I was feeling well, I felt, well, we don't need to run and do this right now. It's a condition that was correctable by surgery only. And so I kept putting it off. And you know what they say, lesson, take care of your body, because it's the only place you have to live in, right? If you don't take care of it. And so I mean, in health and wellness, you really want to listen to your body signals. I had all the signals, and I had all the tests that had been done, and that had been proven that you may come to a screeching halt if you don't take care of this soon. But, you know, I was there saying, oh, well, you know, I feel fine. Let me go ahead. And, you know, until I start to feel a lot of things, then I would take care of it then. Well, I didn't know God had a different plan for me. So I'm at work, and all of a sudden I lose consciousness. Fast forward, I have, you know, a couple of major emergency surgeries and things that happened. And then I went from, keep in mind, I was working for myself at that point. And so it's where if you don't work, you don't eat. And I had two small children, 4 and 6 at the time. And so I went from working full time and enjoying what I did to rock bottom.
Almost disability, kind of.
So actually, I was placed on disability for 4.5 months, not allowed to drive even. And I was thinking, oh no. Oh no, it's oh no. And I'm like, oh goodness, I wish I had. It's already too late.
And a lot of people watching me can relate to that. A lot of my guests on the a lot of my viewers are on disability. So you know what it is. I mean, the money's not that much. Am I correct?
It wasn't really a matter of the finances.
Okay.
I kept telling myself, I'm all this time. Look how much I've struggled to
Mm-hmm.
get here and be a professional now. And it was less than a year after I had received my license and graduated from
That this
residency,
happened.
less than a year that this happened.
Wow.
And it was really a major emergency situation where, I had to have blood transfusions and things. I stopped breathing at a certain point. It was just really terrible. And I looked at my daughters and I said, well, I can't take care of these children from this bed. I mean, my mom, bless her, she came down, had to live with me because I was in bed at that time.
Oh, wow.
And it wasn't really much of my physical condition.
Mm.
It was more of the fact that I've struggled so much for years trying to get to this place where I could fulfill my passion. And right now I'm stuck. My body is not going to allow me to proceed. And I'm like, God, what is going to happen to me now? I went from sadness to anger to depression to anxiety and back to sadness. And this went on for 4.5 months. You cannot imagine. And through all these emotions, and it wasn't so much the financial part of it, because I have to admit that I wasn't struggling financially. I wasn't really in the financial disability. It was more of my physical disability and the fact that I couldn't wrap my mind around I wouldn't be able to do what I can, and also coupled with the fact that no one could tell me when this process, or if at all the process, could reverse itself to where I would be up and doing what I needed to do. So the doctors couldn't tell me that I'm a doctor yet. They couldn't tell me. So I'm like, oh no,
Wow.
what's going to become of me now? So that's where my depression came from, and all this rock bottom. And I remember the only solution I felt I had at that time was to start praying. I'm like, God, forgive me. I mean, all this time I haven't been praying. I think if I start praying again, it would be okay. And so I spent a lot of time in the scriptures. And don't ask me what they were, because I'll read one thing today, I can't remember the next day. But it speaks to me at the time.
That's right.
So I kept reading and researching, and I would always read a passage and study more into it. What does it mean? How do I apply it into my life? And somehow I figured out that I could do a prayer fast for 30 days. And I was so convinced. This is where, when you have faith, and this is where a God is so wonderful, right? You could come to Him even after you've been so unfaithful and ignorant for so long.
The mercies of the Lord.
You could come back to Him, and He'll still take you, just as you are, and bless you. So I figured out, still in my selfish mind, I said, I'm going to write down all what I want from God. The first thing is to be able to get out of this bed and get well.
Okay.
The second thing is to be able to I wasn't so much reaching out as God, I want to know you better. As I figured out through all this study, I could lay out a list of things that I want. And I could really believe in these things. And as the Bible says, ask and you will receive. And I was sitting on that and I said, Lord, I will ask you. But in this process, I studied so much of the Bible, and I just started changing. I mean, I was the one who, when I was in Italy, if those of you who are Catholics, we know the Vatican is the head of the Roman Catholic Church because the Pope is there.
Right.
And I was the one who said, who cares about the Pope? Because
that was like abomination in Rome, right? And you don't say that kind
I
of
didn't
stuff.
say it aloud. I said these things to myself. Hey, I was a student just trying to survive, okay? I wasn't doing much more than trying to look at my books and take care of my lady and do everything I was supposed to do. I wasn't doing much, and I wasn't speaking about much.
Right.
So I was just this kind of, if you go to Italy, nobody would know who I am, because I kind of really just stayed in that narrow place. Trying to study and get out. And so I broke some kind of boundary of myself and Christianity to understand that anybody and everybody had the ability to reach out to God and have that personal relationship with God, and it was okay.
Wow.
It wasn't like that for me growing up. I felt or I understood, and I may have been wrong at that time. Maybe that wasn't even what they taught me, but I understood that it had hierarchies. So you had to learn from the priest or the reverend
Right.
sister. You couldn't go directly to the Bible, and it's enough in the Catholic Church that we have to go to the priest to tell him our sins, right? So I had problems with that.
Oh.
I can't be going to another person to tell him my sins, and then they would deliver to you a series of punishments and say, you have to say this prayer and that prayer and that prayer, and then your sins are forgiven. So you see, I had challenging problems like that, which I
Right.
couldn't verbalize.
Mm-hmm.
So I just shied away from it. And then in studying the Bible at the time, I got to understand that
Wow.
I could speak directly to God and say, wow, look at all these
And
things
that was
I've
your
done.
first time really
It was my
reading the
first time.
Bible.
Yes, in
Wow.
2006. I mean, I was
That
already what? I was pretty old at that time.
is-
I was pretty old
Oh,
older at that time. I
the
mean,
mercies
I
of
already
the
had
Lord
two
are
children, and
everlasting.
I
That is
remember
amazing.
I remember sitting here, even though I was so selfish, and telling God, you know, I would love to be healed. I'd love to get back to work. I'd love to be able to take care of my children. I don't know that these children would want to grow up to adulthood with mom in bed. So please, Lord, release me from that bondage also. And in that process, I also learned, you know, then I would also need to get closer to God. And I was like, oh, wow, okay. So this now, and it was so relieving. This now I can have this personal relationship.
That's right.
Then I started to understand, where am I going as a Christian, which I
Right.
never thought about. And you know, we're just passing by this life, and where will I go?
So it was
And
more of a relationship
it
than
was
just a
more,
religion.
yes, a
And
relationship and a relief. And
right.
look at that. And through this 30 days, and also in that at that time, I said, Lord, if it is your will that I would be disabled, please help me start a medical practice that I don't need to work in, that I could make an impact to the population
Wow.
by having this practice, even though I could engineer and I could manage it from my bed. I
Wow.
call my bed my command station.
Wow.
And so in those 30 days, I cannot, every single thing that I wanted was granted. It was incredible. And I also, you know, got to figure out, you know, let's not take God for granted. You know, just because you've had all these things, you want to stay in this place, in this relationship, because this is the most valuable relationship that we have. And I'm not shy of speaking to my patients about my religion.
And this
And
helped your children because they started going to church, and I'm sure it built a little bit of awareness of what Jesus and
yes,
who He is.
yes, it's a
Wow.
foundation. It's so important, and you know, I keep saying that I was reckless, and I look at it as recklessness when you shift away, and it happens. I mean, you shift away from your relationship with God, and you just go about your daily life, and you just go back and forth doing different things,
Wow.
and don't stop to have that relationship again. And I was like, wow, how reckless was I? You know,
Wow.
and God allowed me. He said, okay, child, sooner or later, you're going to come back and you're going to need me. So, I mean, he lifted me
Praise God.
completely. I was healed. I went back to work eventually. And, you know, I was able to start a clinic from my sick bed. It was incredible. Most people don't realize it, that I actually started my clinic while I was bedridden. I mean, it
The
functioned for a
urgent
year without
care.
me. Yes, it functioned for 1 full year without me working in it
Wow.
physically. But most people don't realize it. I wasn't working there full time, you know, but um, God blessed me, right? And he still does till date. It's a personal freedom
Mm,
that's it's difficult to
amazing.
describe.
That's powerful. So just give us an idea how you transited from being a regular family physician, and this is in your past, but I think it's important because we're talking about the girl child and the female entrepreneur and, making an impact in your generation. So how did you go from primary care to urgent care? A lot of my viewers don't understand the difference. So you may want to give them a little snapshot. And you did this in the before 2008 or 9
Yes, I started the first urgent care in 2006, actually.
in
In
West Monroe.
October, yes,
Was
October
that
of
the first in the
2006.
area?
It
No.
was the second
Was
in
the
the area.
second? Okay.
Yes, there had been one
Wow.
before that. When I was a resident, um, I already knew. I mean, there's certain things that you feel when your passion drives you. And I already knew that I was going to be in private practice. I was the one to be in private practice. And then as I also was the one to want to use my hands a lot.
Mm.
And so I figured out that the best way to continuously use my hands in procedures are things are in emergency medicine,
Hmm.
because we get to, there's a lot of skilled work
Procedures, right?
in emergency rooms. So I did some of that in 2005 before I fell ill right after graduation. And then I also was debating between primary care and emergency care, but working in the emergency room, I found that most patients, and that's even true today,
Mm.
most people show up in the emergency room
They don't need to.
without emergencies.
Oh, okay.
Certain things need to be taken care of quickly. We don't need to wait for our regular doctor's appointments either. Say you have an infection and things like that, you want that treated quickly. But
Wow.
then it's not an emergency, it's not a
That's not.
life-threatening condition. So that's how I started looking into the urgent care. Where do these people really go? In the emergency room back then, they call it fast track for the bigger emergency rooms. You
Mm-hmm.
have people who go through fast track. These are small things that can be taken care of. But the cost-wise for the patient and time-wise for the emergency room physician and those patients who are having true emergencies,
It's not
it's not
worth it. Okay.
effective for
Okay.
anybody. So that's why I
Mm.
came up with the concept of the urgent care, and I
And I
studied
know you
more into
called it
that.
stat care.
Yes,
Okay.
American Stat
And you
Care,
had one in Ruston, one in West Monroe. Am I correct?
and one in Monroe
And
at a
one in
certain
Monroe.
point.
Wow. I mean, that's amazing. I'm really impressed. I mean, people think doctors are bad business men or women. I mean, you open businesses like you were just opening candy stores. I don't know. How did you combine
But those
medicine
are
and
close
business? Well,
now,
I know
okay?
they
Because I'm
are.
a lot
I know.
older, don't have that much energy.
But still, the the zeal of entrepreneurship was impressive. You
Yes,
broke a
yes,
mold in the female physician stratosphere
yes.
by doing those things. So that's very impressive. And you even opened one when you went to Dallas. So I'm like, goodness, what kind of woman is this? So what did you do that other female physicians don't know? I mean, you just saw an opportunity among those ER patients and you took advantage of it.
I don't. I think it's a combination of several things. And I think that it's interesting to me though that you say female physician,
Mhm.
and most, we sometimes there's this glass ceiling effect
Right.
that we have on ourselves, and I've been guilty of that also. I wrote a book, Grow to
Yes.
Success,
Yes.
that became a bestseller,
Oh, wow.
an
That's
Amazon number
fantastic.
one bestseller.
Wow.
It's called Grow to Success. And I'm of the firm belief that each and every one was born with an ability to succeed.
Wow.
We get limited by our limiting beliefs.
Mm.
And the only person who can limit you from doing what you really were put on this earth to do
Is
is
you.
yourself,
Right.
right? And so I spent quite some time just thinking about what is it that I want?
Mm.
And I felt that the biggest thing that I could do with my time on this earth, and it's still the biggest thing that I can do right now, I'm a lot older. I keep saying I'm a lot older than I was at that time. So I don't have that much time to make an impact. But the most important thing for me to do is to make an impact in somebody else's life.
Mm.
Very important. And so when I came to this community, I first of all came here because I love the small communities. I've lived in big cities. Before I came here, I also went to Dallas, like you said, at one point, still came back
Mm.
because I like the small community. And I think that being in a small community gives you the opportunity to make a bigger and worthwhile
Impact.
impact
Mm.
for me. And that's really part of my life, going through on this earth is
Mm-hmm.
to make a difference in the
Difference in
life
people. Wow.
of anybody, the next person,
Wow.
one person at a time.
I never
And
asked you why you moved from Italy to the U.S. I mean, a lot of doctors who train in Italy just stay in Italy. What was the I mean, you wanted to do more than just Italy. You wanted to cross the pond, like they say, and see what America had to
it
offer.
was two things. When I was going through medical school in Italy, at the time I was convinced that there's not much of an impact I can make of myself
In
here.
Italy.
And also my government has started to change. When I went to medical school in Italy, my goal was to learn and go back home
Oh,
and work as a physician. But because of political troubles and things, my dad started to tell me, he started to tell me towards the end of my studies, no, 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 you cannot come back here.
oh,
And I already knew that in Italy, I would probably not make such big impact. So my next choice was the United States.
okay.
I didn't think about England or France and things like that. I said, I'm going to go where I can learn from the best.
Wow.
And that's how I ended up here.
In Monroe,
How I
Louisiana.
ended up in Monroe,
How did
Louisiana.
you end up in Monroe?
I
Dr.
had
Givler and co. I mean, how did
Yes,
you?
I love it, Conway Hospital. I had lived in Washington D.C. I had actually done 1 year of transitional medicine
Wow.
in Washington D.C. And
At
I could
the
have
National Hospital
in
or
Howard University
Howard? Oh,
Hospital. I could have stayed there and done family medicine, but it's so big. It's such a big city. I
yeah.
wasn't really fitting well into the big city life. So I applied for residency
Okay.
to smaller cities.
Oh,
When I came down to Monroe, I remember back then you had the map quest printed out, and I'm driving through all this bumpy roads, and I was like, wow, this reminds me of home. That's
oh,
the first thing I thought about, the home,
environment.
the homely environment. It was
Wow.
so small, and I just felt like I fitted in. Have never regretted it. I mean, I've
Praise
been to
God.
Dallas in the meantime, still came back here.
Came back here.
Still feels like home.
And I just remember now you had this John Maxwell speaking. Are you still doing that?
Yes, yes.
Okay. One of the speakers in the training for the John Maxwell mentorship. So Dr. Yembe is a woman of multiple parts. I mean, she can go on and on about her. But let's just focus on the career part now. So you went from primary care physician to urgent care physician.
Right.
And then you now went from urgent care physician to ER physician in a little bit of an interim while you were transiting from Dallas back here. Now you're back in primary care.
Right.
Can you compare all three? Because a lot of my patients don't know the difference. I mean, to them, it's the same doc, it's the same procedure. Is there a difference in your insurance, for example, when you go to an urgent care compared to going to your primary care compared to going to your emergency room physician? Are there differences that people don't realize that
Well, let me
exist?
speak on the professional part.
Okay.
The insurances are very complicated,
Yeah.
and so I may not be the
And it
best.
depends on
I
what
may
you
not be the
have.
best one to ask for that information. But what I feel that if you go to an emergency room with a non-emergent condition, you end up spending more
Okay.
because it's a non-emergent condition that could have been taken care of in a
So your
cheaper
insurance may not
way.
pay for that visit.
Probably. I'm not
Okay.
sure, but
Right.
from the insurance aspect. Now, so it's more cost effective to go to an urgent care for an urgent problem that's not an emergency. And I'll give you an example of an emergency. An emergency is a life or what the common person perceives as a, a threat to their
To
life
their life.
or loss of limb or even vision. So if we have something like chest pain or shortness of breath, or you start to go blind in one eye, or you cannot move, these are emergency signals that say, go to the emergency room now, because we feel that our lives are in danger. A non-emergency is say, well, I was cooking and I sliced my finger.
Okay.
Okay, it's bleeding a lot. It's not an emergency because we're not going to lose our life. Another example of not an emergency is I will be out of my blood pressure medicine tomorrow. Look, I've got just one pill. I need a refill and my doctor's office is closed.
That's not an emergency.
It's not an emergency, so there's nothing wrong with me, right? I just need a refill and I cannot get to my doctor. We want to go to an urgent care for that.
Right.
And then the primary care doctor is the one that you see on a regular basis who keeps your entire medical dossier. You need
In
one
one
person
place.
to
Right.
keep together your entire medical history, make
Mm-hmm.
sure that your medical care is coordinated. That's your primary care doctor who would take care
Mm-hmm.
of primary care problems for you,
Wow.
like diabetes, hypertension, and things like that, COPD, heart failure that is stable, and stomach problems, just regular family medicine.
And then you went on to do some aesthetics procedures,
Oh yes, and I could
Botox.
talk about that forever.
Okay. Are you still, I know you have a new practice in Colombia. Are you still doing that?
No, I'm not
Not right
doing
now.
that now.
Okay.
And with the emergency medicine, I did emergency intermittently throughout from graduation till date. It's
Oh,
just that at some points I did it full time, and at some points, like now, I do it part time.
okay.
The aesthetic medicine, I always tell people, if you look in the mirror and what you see doesn't really match with what you thought you would see, well, this is the time to do
Do
something.
something.
Anything. Do you need a haircut? Do you need a shave? Do you need more?
You
There's
can,
nothing wrong with
there's
that.
nothing wrong with that.
We're
I
not talking
agree.
about extremes, but we're
Right.
just talking about what you feel
Maintenance,
like
right.
doing that makes you
Make you feel beautiful,
exactly.
right.
And I
And
don't have any problems with that.
yeah.
I don't have any Botox or
So,
anything like that. So don't get me wrong.
so
But I don't have any problem with it. Should I get old enough that I need it? Or should I get to a point where I feel like getting some? Yes,
you
I have
have
no
come
problem with it.
you've come a very long way for an African female physician, and all of us in the African contingency are proud of what you've
Thank you.
achieved, and
Thank you.
what a pleasure to know you. Dr. Yembe is going to come back next time we talk next week, and she's going to highlight what people perceive as what they say females cannot and females can. And
Yes.
she's going to tell us a bit about her road to success and what she considers success tips as a female. There are people who think there's a glass ceiling, there's a limit, there's no opportunities, that women don't get paid equal salaries, they don't have equal opportunities because they're not as often in the labor market because of time off to have kids. People have that premonition, and she's going to share with you her thoughts on all that, because I believe there are young men and young women watching who can become the next Enakayembe. They can change their environment, they can alter the status quo, they can break the mold, they can become the pivot for their families to live a successful life. And I'm hoping that you'll join us next week as we share about career and community and how you can become an influence, a positive influence in your environment. She's influenced her community as a clinician. Whatever you are, pastor, teacher, whatever artist, you can influence your community just as well. Mother, housewife, whatever. You can change that environment and make it a positive outlook. So don't miss this show next week. Dr. Nakayembe is throwing everything, her marbles on the floor. You want to grab some as she shares it. Reach out to us, P.O. Box 550 71294 Faith and Power Ministries, or check us out on www.faithandpower.online, and join us on our last Friday of every month, Holy Ghost Night at Claren in Monroe, Louisiana. God bless you. Jesus is Lord. Amen.